I want to stay focused here on the most urgent elements of this story, and those continue to be the concerns about whether or not we have the capacity to handle what is about to come in terms of equipment, in terms of hospital beds, in terms of ICU units, not just in places like New York and California, but particularly in those places. Tell us what you're seeing right now in terms of that question, and what you're hearing in the naked kind of alarm on the part of people like Governor Cuomo that we are not, in fact, ready.
Well, it's looking more and more like we are not ready. Our projections had shown that we were ready for a mild outbreak, but not for a moderate outbreak. And looking at the numbers from China, from Italy, it does look bleak. I mean, it does look like we're headed towards this rapid escalation phase where we're going to be short tens of thousands, maybe even hundreds of thousands of ICU beds, and we're not going to have enough supply. So on the one hand, we have to increase the supply of these services rapidly through telemedicine, through surge capacity in hospitals, maybe by building additional field hospitals. But we also have to try to decrease the demand for these services. And that's why all these social distancing measures are so important, because we don't know where the peak of this curve is going to be. Right. But we actually have an opportunity now to try to flatten that curve and try to reduce demand. And that's why every single person in America needs to adopt this wartime mentality, because we are really at war and with a very narrow window that's closing.
Dr. Wen, I just want to stick with you, and I want to put up a headline here from the Washington Post about Italy, where it says here, ICU beds near full capacity in Italy's hard-hit Lombardy region. Italy has more than 2,500 deaths, more than 31,000 total cases. Italy is a decent-sized country, but a very small country compared to the United States. And we are told over and over again that what it looks like here is that we are following the path of Italy. We may be only a few days behind it. So I totally taking on board the notion that there are a bunch of things we're trying to do to flatten the curve. It strikes me, if you believe those stipulations, that we're going to have a gigantic problem, the one that Governor Cuomo is pointing to, in terms of just having the hospital system overwhelmed. And I wonder what that will mean for how medicine is going to get practiced on the ground, what it will mean not just for the treatment of this virus, but also for all of the other things that the hospital systems in these states are normally used for, emergency services, other kinds of surgeries that people have to undertake. Just paint a picture of what it might look like a week from now or so in terms of the capacity questions that I'm talking about right now.
Well, it depends on what we do right now to try to flatten that curve. But let's say that we do nothing. Let's say that our interventions are not successful. We could be looking at needing 200,000 ICU beds, which is the projection for what happens in a moderate outbreak.
Right.
But the U.S. only has 100,000 ICU beds. And so most of them are already occupied with patients with these other conditions, as you're mentioning. And so what's happened in Italy is that physicians, nurses have been put into the untenable situation of having to ration healthcare, of having to decide who are the patients who can have the best chance of survival, who are the patients who may have to go without healthcare. Right. And you're right that it's not just the COVID patients, it's also other patients who are coming in with trauma, heart disease, strokes, who need these ICU beds too. And that's what we could be facing. But I do want to emphasize, though, that we have a chance to flatten the curve and prevent that from happening.
Jonathan Lemire, you're reporting on this White House all the time. I'll note that the last couple days, as President Trump's tone has turned a little bit better, we're going to talk about this a little more in the show, about his tone being a little more tethered to reality than it had been in the previous couple months. It's still the case that he's talking in a lot of vagaries about things like the ventilator issue, about things like the Army Corps of Engineers. Governor Cuomo says, hey, you got to send the Army Corps up here to start building these hospital beds and these ICU units. And the president says things like, the Army Corps of Engineers, that's something we could do. But to me, it's like, it doesn't seem like though his tone has gotten better on these tangible things like the ventilator orders, the ICU beds, the Army Corps. It's not like we're seeing tangible movement of resources, and time is wasting.
No question. John, first, just a quick update on something you said at the beginning. The governor of New York actually just put out, his spokeswoman just put out a statement saying that blanket quarantine shelter-in-place policies require state action, and so far that is not under consideration. So apparently he is suggesting that what Mayor de Blasio said earlier about New York City may not be in effect. Let's, of course, remember, those two do not not always communicate particularly well. So we'll have to see how that unfolds in the days ahead, but that at least appears to not be imminent. In terms of the White House, you are right. I mean, there's no question in the last 48 hours or so, and we've done some real reporting on this, the president's tone has changed. And this is not something that should be applauded necessarily, or frankly, something that should be expected to continue. This is where he should have been all along. But he is certainly more clear-eyed about this. He is more somber. He has realized what a threat this is to not just the American populace, the economy, but also his own re-election chances. One of his senior aides, Jared Kushner, has been telling people he believes it's going to require a World War II-style national effort to get through this. But in terms of concrete promises, they have been few and far between. The briefing today, there's talk of yes, we'll get ventilators, and yes, the Army Corps of Engineers will be involved, but there hasn't been any concrete promises. They're saying they're coordinating with the states. They still want to seem to defer to the states on a lot of this. He suggested that a lot of the governors and the states have existing relationships with these manufacturers, and therefore it would be easier for them to obtain ventilators, let's say, than the federal government stepping in. But it's going to require a lot. And the action today, actually, at least the rest of the day, seems to be shifting more towards Capitol Hill, where there are negotiations. The Senate is going to meet, obviously, try to pass this first relief bill, but also the early stages of perhaps what could be up to $850 billion stimulus package for an economy that is going to need a lot of help right now, going to need a lot of shoring up, as yesterday the White House basically unveiled social guidelines that will rewrite how Americans behave for at least the next 15 days.
Right. So, Tim Miller, you're out there. You're now a transplanted Californian, back to my native home state. You're in Oakland, I believe, and so you're covered by the shelter-in-place order from San Francisco, from the Bay Area last night. It's now a live consideration here. There's some dispute between, apparently discrepancy a little bit between where the state is on this versus where the city is, and Mayor de Blasio, but Mayor de Blasio has clearly put it on the table, and there's a lot of discussion about it here in New York City, as you can imagine. Give us a sense of what it's like to be out there, how it feels, what it looks like on the ground in the Bay Area, as you guys are now about 16 hours into shelter in place.
Look, my main takeaway from this, and I've been sheltering in place besides a drive down here, but anecdotally hearing from friends and what I saw on the drive is that it takes a while for this to get socialized, John, and that's why I think if you listen to what Dr. Wen said about the urgency of this, the days are ticking and time is ticking. What I saw is obviously not the normal bumper-to-bumper traffic that you see here in the Bay Area, but I also did not see a ghost town, right? I think that there are still people going to stores. There are still people going to work here. We do not, and it's good that we do not, have the same levers that the Chinese have to, forcibly make people quarantine. And so what we need instead is the leadership and explanations from the leaders about why this sacrifice is necessary, something the president has been unable to do. And what you need is the time to get people socialized and understanding that this is the new normal for a little while. And so here we are 16 hours in, and obviously while there's some progress, and while that's good and it was a good step, you haven't seen kind of the dramatic measures that you may be imagining.
Dr. Wen, I want to come back to you and ask a little bit more about this. I mean, first of all, given the urgency of the situation, and given, as you said, we have a chance to flatten the curve, but the chance is fleeting, the opportunity to do this. Is it your view, number one, that really the shelter in place should be adopted in New York City, adopted in Chicago, adopted pretty much everywhere, number one? And number two, given how big these cities are, given how diverse they are, given the general anti-authoritarian impulses of a lot of people in these cities that don't do what they're told, even on the best day, when the kinds of costs that are imposed are considerably smaller, how long does it take once those orders are issued for people to actually follow them in a way that will be meaningful in terms of trying to achieve the goal that is ultimately all of our goals, and the goal that you're laying out in terms of how do we keep this from being a severe outbreak and keeping it to be something more moderate than that?
Look, it's extremely hard because we haven't lived through something like this before. This is unprecedented for all of us. And all these public health measures are a balance between doing what's right for the public's health and interest and balancing that with individual liberties. And so the ideal is that people just do this on their own with voluntary measures, and we don't have to shut everything down. But we're seeing that that's not actually happening, we're canceling schools, but instead people are going on play dates. We're canceling work, but people are going to bars. I mean, people need to step up too. Ideally, we don't have the government crack down and shut down and imposing imposing these draconian measures as they did in China. But at some point, that may become necessary because at some point, we are going to get to this point that's really untenable, and we have to safeguard people's lives at all costs.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.